show, and I'd like to thank everybody who responded and corresponded with us after our show last week, and gave us a lot of information, a lot of feedback. We'll be actually addressing some of those questions that we got after the first show. But what we spoke about last week, of course, is that the purpose of this show is to inform the world, if you will, that there are now very, very effective treatments, not only in the office but at home. In fact, this is one of the most exciting things about our work, is getting patients independent. There's now such a wealth of information that we have, having treated neuropathy and chronic pain in a non-surgical setting, that there's a whole lot more that we can now do for patients like yourself, maybe a family member, somebody you know. But what I'm going to do is to take a few moments and try to pick up a little bit where I left off last time, and that is to talk a little bit more about what exactly is peripheral neuropathy. As we said last week, neuropathy really is your doctor's word for nerve damage. Technically what it means is that there is something gone wrong with a nerve. In nerves, of course, from a very, very simplistic perspective, are the elements of the body that allow us to communicate with the outside world and then allow the outside world to communicate back to our brains. When we talk about peripheral neuropathy, we're talking about damage to the nerves of the peripheral nervous system. We also said last week, and I think it bears repeating today, that chronic pain in many, many forms oftentimes does have a component of neuropathy or nerve damage, and that is a very, very important factor to note, because that is one of the things that ties together a lot of the successes that we're now seeing in the clinics with regard to neuropathy. But what I'd like to do next is to just talk a little bit more about, let's talk about one of the most common things with regard to chronic pain in particular, and that is going to be the word that you may hear called idiopathic. I mean, idiopathic is basically the word that we as clinicians use for we don't know. When we have a patient that presents to us with a condition, we're not really sure what caused it, or what number of factors might have led the patient to develop a certain illness or disorder. Sometimes that label is thrown out, so you will hear that word. But the fact of the matter is that as we also started to speak about last week, there are things that we do know about chronic pain and neuropathy in particular, and that is that patients that are exposed to heavy metals, environmental toxins, for example, petrochemical exposure, heavy metal exposure like mercury. Mercury is something that's present in the environment. It's what's called ubiquitous, meaning it's pretty much everywhere. And that's a whole other show. That'd be a great discussion for Mark, or with Mark some evening, which I'm sure we'll have in the future. But the bottom line is that we do see patients that have had, for example, mercury contamination. We have seen patients with a mouthful of amalgam dental fillings, for example, have neurologic issues. We have seen patients have had environmental exposure to mercury by consuming too much freshwater fish, and so on and so forth. We see patients that have been exposed to arsenic, people that have worked on farms, and that type of thing. Even old pressure-treated wood was treated with arsenic, so there's some some environmental issues there. But some of the other sources of exposure to be aware of, probably the biggest exposure that we have in most of our lives is what goes on in the household. Be very, very careful about what you choose for cleaning products in particular. Be very, very careful about how you ventilate your house and how you filtrate your house. Air can make a big difference too, and everybody, not only your family members but your pets even, you'll find are very, very responsive to your indoor environment. One of the things that we started to talk about last time, but I want to talk quite a bit more about this time, is that there's a whole component of chronic pain that we in the clinic call compression disorders or compression neuropathies. And you might be familiar with this as having sciatica, which is pain down the leg from compression of a nerve root in the low back, or carpal tunnel syndrome, which actually is compression of the median nerve at the wrist. And another one that we see oftentimes in electricians, automobile mechanics, is what's called cubital tunnel syndrome, which is where the ulnar nerve, which is the major nerve supply to the hand, gets entrapped or impinged at the elbow. So those are some of the most common things that we see in the clinic that are responsible for, not only acute pain, but unfortunately too many times chronic pain. There's a couple other conditions that we, of course, need to mention at the beginning of any discussion with regard to neuropathy or nerve damage, and that is that, as I have mentioned before, is that these effects can be additive. In other words, if you are diabetic, or let's say have undergone chemotherapy, and you also have some significant arthritis, well, those effects can be additive. If you have thyroid disease and arthritis, those effects can be additive. So all those things need to be taken into consideration. But the reason I mention that is that almost everybody has a certain degree of spinal degeneration or wear and tear as we age, sometimes at young ages as a result of trauma, athletic injuries, motor vehicle accidents, falls. I mean, you name it, the list just goes on and on and on. But the fact of the matter is that these conditions in and of themselves are responsible for much of the chronic pain that we do see in our society. So with that said, what I'd like to do is to introduce a segment we're going to put into the show on a regular basis, and that is news. There's a very exciting article in the news. In fact, it's exciting for residents of the United States, but people that have lived in Europe for a long time know this already. But the fact of the matter is that there's a study that was recently published that suggests very strongly that a common nutrient called alpha-lipoic acid, when administered to diabetics, can have a very, very profound effect on the diabetes, not only the blood sugar levels, but also on the progression of neuropathy, and also another very, very significant benefit is anti-aging and also liver health. This study that I'm looking at right here, and I will put the quote on the website for you, basically talks about the observation that diabetic patients who are given a certain form of alpha-lipoic acid have some very, very dramatic improvements in their diabetes and in the neuropathy. And I will say also that part of what we do in the neuropathy clinic is the administration of a combination of nutrients, not the least of which is alpha-lipoic acid in combination with other co-nutrients that can have a very, very powerful effect. But one of the most important things, as we talk about all the time, is do not self-medicate. That includes dietary supplements, because one of the things especially to be aware of with supplementation in diabetic patients is it can have a very, very dramatic and profound effect on your blood sugar, and that's not a trip you want to be taking by yourself. So it's not even though it's news, it's not a recommendation for self-prescription. So with that said, we'll be right back after the break. You're listening to Beating Neuropathy on 95.9 WATD.